Thanks, everybody. I appreciate being able to be here from what I told Dr. Holt was the northern border of the Southern Medical Association and West Virginia. I wanted to talk about obesity, and of course you've heard this and it's been in the news a lot, but I thought to bring it home to many, if not most or all of us, was to put it in the context of what's happening to the baby boomers, which are people aged 49 to 69. Not that that applies to any of us in the room, but just in case it does, or you're close to that, then you need to pay more attention. Somewhat staggeringly, when you put it in different terms, there's 100 million obese adults in the United States. In other words, if there's 300 million, then there's 100 million obese people. And these are the classifications above your BMI, the kilograms per meter squared. As you know, normal weight is 18.5 to 24.9, and then overweight is beyond that. And then obesity is a BMI of over 30. Now, this is the map, and it shows my state very prominently, and so I'm always a little embarrassed when I show this map, but you know, I hope I didn't cause it. But the prevalence of self-reported obesity, this is from the BRFSS, which is a survey, a behavioral risk factor survey that's done. Interestingly enough, the actual is worse, because this graph, which you see in USA Today, you know, every year when the new one comes out, is actually how many people are obese when we called them on the phone. Now, imagine, it's always a little worse, and you always see this conflicting in the medical literature, because when you actually weigh them, it's a little more. I mean, you know, what if I asked you, what do you weigh right now? Well, you know. Okay, so, and then a lot of the PR lately has been saying that obesity is really leveling off, and it doesn't seem to be as much of a problem, and it seems to have reached its peak. Well, I beg to differ. Take a look at this graph and see if you see any leveling off effect anywhere in the world. That's not true. The consequences, need I remind you, of obesity are coronary heart disease, type 2 diabetes, cancer. That's right, cancer is actually more common and more serious in people with obesity. Sometimes we forget about that. Hypertension, of course, the excess lipids, stroke, liver and gallbladder, and not to mention sleep apnea, and the biggest plague of baby boomers right now, which is hip replacements and knee replacements. The biggest booming thing at our hospital is, of course, the Alzheimer's wing and the hip and knee replacement wing. Now, so we asked people, so we did a study in the West Virginia Practice-Based Research Network, and we said, well, we didn't just walk up to them and say this. Of course, very nice, sweet medical students did this in the waiting rooms in about 30 different clinics. But we wanted to know if they knew if they were obese. And so we asked them what their weight was, and then we asked them if they knew what a BMI was, and if they knew what obesity was. And the answer was no. And so apparently, even though it's on the cover of USA Today and the New York Times, our patients still don't know that they are obese. They know there's people that are, but they don't know that they are obese. And I'm going to have to tell you doctors here that it's because you didn't tell them. Now, we have to use the proper words, and so we're also not allowed to use the words overweight or obese. And so there is a communication problem, isn't there? Well, how are we supposed to tell them if we're not supposed to use certain words? Well, we're going to have to use medical words, but we're going to have to say something like, well, you have a pounds problem. All right, so the lessons from the baby boomers. Now, you know what the baby boomers are. They were born between 46 and 64. We had a baby boom then, and there were 78 million children born then. They make up 26% of the U.S. Population. And right now, just for comparison, people over 65, there's 40 million of them, and that's as many people over 65 as we've ever had. Imagine what that's going to be in a decade when the baby boomers are over 65. Just a tremendous bulge of population. And so that's why we wanted to talk about them. And we also wanted to talk about the fact that they've had great opportunities for health. I mean, when a lot of us started out as doctors. There were no such thing as ACE inhibitors, calcium channel blockers, or statins. And so there's been many new insulins, the human genome. Okay, this embarrassing picture was right before a triathlon. It proves that some boomers actually try to get out and move around. I won't tell you how successful we were. We did take first place in our triathlon category. I'll also tell you that there was only one entry in our category. All right, so a recent study illustrates, I think, the situation that we find ourselves in. And so we wanted to find out if we were healthier than our parents were at this age. I mean, I thought that'd be a good comparison. In other words, we're supposed to be the healthiest generation. This is what you see on TV, and we're the active generation, and you see guys running down the beach. Are we really ready to become the Social Security generation? So we did a study to determine the rates of diabetes, hypertension, hyperlipidemia, obesity in the boomer generation, and we compared them to quote-unquote their parents' generation. We said we just picked 20 years because okay, I'll let you know the secret of how researchers do this, because the data was available. All right. And this was in something called the NHANES, the National Health and Nutrition Survey. And the participants, of course, were 46 to 64 years of age in 2010 or between 1988 and 1994. And the main outcomes were health status, disability, and the rates of these chronic diseases. And we took into account demographic factors such as, of course, the age range, gender, race, and socioeconomic status. And we used the BMI categories for obesity. Now, we asked about general health also in the health status. Interestingly, the NHANES changes over time. And in the NHANES 3, which was done 20 years ago, they asked the physician to rate, this is a change in generations, they asked the physician to say how healthy the patient was. And then in the most recent iteration, they asked the patient to say how healthy they were. Interesting. All right, and then this is what I call some of the fine print, but they did ask about disability. And when I say disabled in this, I'm not talking about necessarily, completely unable to do anything, but functional limitations such as I would have much difficulty walking a quarter of a mile or walking 10 steps or stooping, crouching, or kneeling. So when you see the statistics, think about that. Or work disability, meaning you couldn't perform your work. And then, of course, the medical conditions are, obviously, you're familiar with those, and A1C over 6.5 or cholesterol greater than 200. We also asked about alcohol, physical activity, and diet, and we did use, for physical activity, just so you make sure we weren't making you be an Olympiad in this particular study, we just said, do you do anything 1 to 12 times a month or greater than 12 times a month, so 3 times a week, or 1 to 3 times a week. So that was any type of physical activity. And we called walking and gardening, you didn't have to be a basketball player, etc. All right. And this is what I call the fine print. You're not supposed to read this. This is a joke, but it is actually how we did the study. All right, so what you see here is that, first of all, there were a couple changes between NHANES 3, that's the previous generation, and NHANES 2007 to 2010, the baby boomers. And that's in the right column here. Now, the ones in bold, you'll notice there were some changes. So fewer of the people now smoke than their parents did. So this is a good thing. And the reason I'm letting you know that is because there's not very many good things coming forth. I'm trying to point these out. And there's been an explosion in Hispanics in the last 20 years, which you know from the news and so forth. There's a lot more of those people in our country. All right. Now okay, that was the end of the good news. All right, now we're going to talk about, were you in excellent health? They asked our parents that, and 32% of them said excellent, and 26.5% said very good. When they asked us, 13% said we were in excellent health. I mean, by our own admission, we said, yeah, we're not doing that great. And then in poor health went from 0.9% up to 4.4%. Now, this is people And this was people in 2010, so this is not people 50 to 70, this was people 45 to 65, okay? 6.9% of them said they needed a device to help them walk. So that seems like a huge percentage of people that are 50 or 55 years old walking around needing something to help them walk. 13.8% said they couldn't work and they were limited in doing their work. And the functional limitation was up to 13.8%. That was walking a quarter of a mile or stooping down and picking something up and crouching and getting back up. 13.8% of people 50 or 60 years old said, oh yeah, I just can't do that. That would be very difficult for me. And to me, that was just particularly disappointing and astounding. People, of course, attribute things to age. But if you're in 50 or 55 or 60 or even 65 years old and you're in good health, there should be nothing stopping you from walking or stooping over unless you have a severe condition. But compared to their parents, they were 2 or 3 times as likely to have that happen. All right, for the BMI, the reason you see that highlighted there, the 24.8 is highlighted, is because that's much fewer people that were in the normal range. So when you see the statistics of the United States, and you say there's 100 million people who are obese, and it's 33% of the country, unfortunately, the baby boomers, it's more. It's 38.7%. And then actually, we've computed it since then, and it's up to 39%, over 39%. So basically, 40% of baby boomers have a BMI over 30, and fewer than a quarter of them are normal. It's what perhaps you should call the new normal. Now, as astounding as that was when I saw these results at first, if you look down to the next column, which is exercise, and you'll see that exercise 0 times per month went from 17% up to 52%. And remember, this was a survey. They could have fibbed. They could have said they were doing something. And so they admitted, they said, no, I just really don't exercise or do any physical activity at all, and I'm 50 years old. And then 1 to 12 times per month, and then there's a few. So there's almost a division. You've heard of the division between the rich and the poor getting wider and wider. There's also a division of the people that don't do any physical activity. And then you see the people running around in leg warmers and riding their bikes in the colorful gear and everything. You see them. There's a small percentage of people doing that. And then there's, unfortunately, the actual majority of baby boomers that are not who admit that they're just not exercising at all. Now, I said that was the end of the good news. Actually, there is a little bit more good news. We're actually drinking more. And actually, all joking aside, we're actually drinking the proper amount. So I want to congratulate all of us because this is actually the recommended amount, 1 to 7 drinks for women. And I'm sorry, these are the recommendations, ladies. I didn't make them. And 1 to 14 for men. So that's right. Women are only supposed to have 1 drink a day, but men are allowed to have 2. And I always caution people, if you're from Scotland, actually it's 2 for women and 3 for men. That's just the way it is over there. But 62% of people, so actually people have gotten the message about that. So when that's in USA Today and the New York Times, people pay attention to that. When they say eat more chocolate, eat more nuts, and drink red wine, people are actually paying attention to that. So one thing for we researchers to know is that when we get it out into the public, people actually pay attention to that and adopt it. What we need to say is that exercise is good for you. And people say that they know that, but they're actually still, a majority of people are not getting up off the couch. Now, this is for those of you who are numbers disabled. And so I actually put the same information as I did on the previous, but I did it graphically for you. And so I showed the previous generation on the left and the current baby boomers on the right. But we have, so we, the baby boomers, and I'm putting myself in this category, we have more hypertension, triple the hypercholesterolemia, and more diabetes than the previous generation. So we cannot, this is a cross-sectional survey, so we cannot prove cause and effect, But I'm thinking that there's a linkage between our BMI, our lack of exercise, and our increase in hypertension, hypercholesterolemia, and increased diabetes. All these have gone up. Now, there's more results. So you say, well, maybe that's because of age or gender or race or socioeconomic status or other factors. And so you would be correct to think that that would be possible. So we controlled for all those things. And people who are baby boomers now were still 46% more likely to have diabetes, 38% more likely to have hypertension than their parents, or 6 times more likely to have high cholesterol than their parents. So while many of us can claim we got it from our parents, we actually have more of it than they did, which is interesting. All right. Now, this is the proportion of each cohort excuse me, that was exercising, drinking, the percent smoking, and percent obesity. So on the left is the previous generation, and on the right are the boomers. So we know the one on the left shows that we're exercising less, and we're drinking more, but we're drinking the proper amount more, so that's good. We're smoking less, so that's also excellent. And then, of course, we have more obesity. Now, you say, well, why? What are we doing differently? So we did a study that we published, and I wanted to put in a plug-in for Dr. Holt in the Southern Medical Journal. We published this in the Southern Medical Journal last year, looking at what we called specifically diet-sensitive nutrient intake. So health-sensitive nutrients in the baby boomer generation. And so we said, well, isn't this interesting? The baby boomers take in, look on the left, and the same thing, the previous generation is on the left and the boomers are on the right. So we take in more calories than our parents did. Then next to that is fat. And you say, well, that's interesting. And these were all statistically significant. We consume more fat than our parents did. Then the next one, it was difficult to count all the fruits and all the vegetables, so we counted vitamin C intake, and lo and behold, baby boomers took in less vitamin C than their parents did. Then, of course, we consumed more cholesterol, more sodium, and fewer veggies than our parents did. And so we begin to get a picture of why we might not be as healthy. Now, I was going to ask you, what about fiber? I mean, we've had a lot of emphasis on fiber. There's advertising, there are full-page ads. If you pick up a box of cereal, it tells you how much fiber is in there. You know about good fiber and bad fiber and soluble fiber and insoluble fiber. You know about wheat fiber. You know about bran. You know if there's muffins there, if there's a big bran muffin or another muffin, you say, I got to get the bran muffin, it has more fiber. If you eat Cheerios, then we say, I got to have Cheerios or I got to have oatmeal because it has fiber. Everyone has become fiber conscious. And so some of you are shaking your head and say, yes, of course we have. So we did a study to see in the last decade how much fiber is being consumed. And lo and behold, it hasn't changed a bit. That is the amount of fiber, average fiber daily consumption in the United States in each 2-year period in the last decade. And so I was again shocked to find this, and it's actually very difficult to get published in the Journal of the Academy of Nutrition and Diet because, you know, it's a bunch of dietitians. But they said, no, we got to let people know this because this is shocking, and this is going to be quoted, that we're actually not eating any more fiber than we were a decade ago when no one had heard of fiber. So it was very disappointing. Now also, if you look on the left scale, it's right around 15 or 16 grams. Do you know what the Institute of Medicine recommends that we take in? Does anybody know? 25, right, 25 to 35. So it's also remained, you know, about 2/3 of what is desirable. So now you'll also see in the USA and New York Times that we have a longer life expectancy. And you say, well, Dr. King, you've told us a bunch of stuff. I don't believe any of it. We're living longer than we did. But somehow we're living longer even though we have more hypertension, more hypercholesterolemia, more diabetes, more obesity, more disability, worse diet, less exercise. Well, I have a suspicion about that. And this was also published in the Southern Medical Journal. We take more medicine. We take more drugs. No, I should say medicine. I don't want you to get the wrong impression. So we actually we're living longer, but we have lower overall health and more disability during those extra years. And so as far as public health is concerned, this is actually sort of a failed situation that we're in. And it's very concerning. Is there hope? Now that I've completely depressed everyone at 5 o'clock cocktail hour, and you're going to go out of here and you're going to want to drown your sorrows, I have to give you some hope. And so I'm going to do that right now. Can we do it? If you exercise more, if you adopt a better diet, does it help or is it too late? The Framingham study, the Nurses' Health study, the long-term cohort studies, the ERIC study, all of these studies that you've seen in the literature, in the New England Journal of Medicine, JAMA, it doesn't matter which one, they compare really super healthy people to the not, and then they say, no, these people that are not doing exercising and eating, they don't do as well. But they do that from people that were that way from the beginning. They compare healthy people that were 35 and they follow them 7 years, they follow them 12 years, they followed them 23 years, they followed the nurses and the physicians from the time they graduated from school up to now. They've been following these people. And you might come to the conclusion, well, yeah, if I'd been healthy since I was 22, I'd be healthy now, but I'm not. I mean, I'm 58 years old. Why change now? What good will it do? Where's that study? Because this is what I tell my patients. I tell my patients that are 50, 55, I say, no, you need to get out and start exercising, doing something. But you need to have a study that says that's going to do some good, because the studies you have just say, if you'd been exercising since you were 30, you'd be healthier now. But that's not useful information. So we did that study. I'm trying to give you hope. And I think we aptly named it the Turning Back the Clock study. Because we're trying to turn back the clock. So we looked at men and women 45 to 65 years of age in 4 communities across the United States, and almost 16,000 men and women. We collected the data, or they did for us, and we looked at the healthy lifestyle of eating 5 fruits and veggies, exercising, not obese, not smoking. Alcohol was not in this one. And we followed people for 10 years. But what we did, instead of following them for 10 years, we followed them for 6 years, and we wanted to see the people that had switched. We wanted to look at the people that had followed their doctor's advice. So after 6 years, we sort of did a halt. And we said, let's look, after 6 years, let's look at the people that switched from not doing healthy things to doing healthy things, and then follow them for 4 more years. So even though it's a 10-year study, we just didn't look at the people that were healthy at the beginning and compare them to the people that weren't healthy and follow them for 10 years. We looked at the people that were not doing exercising, that were not doing the healthy habits, that were smoking, that were obese, that were doing these things, and we looked at the people that switched and adopted healthy habits and then followed them for 4 years to see, because that's what we're trying to tell people to do. Right? You with me? Okay. And we look at their cardiovascular disease. So what percent of people engaged in all 4 healthy lifestyle factors at the baseline visit? Any guesses? Throw me a number. 12. Okay, even that was high. It was 8.5. 8.5% of people. Okay, so we're doing 4 things. In other words, half people aren't exercising, quarter of people are smoking, quarter of people are eating 5 fruits and vegetables a day. Anyway, if you do the math, it comes out to only 8% of people are doing all 4 of those things. That's right. And the people that we counsel every day with hypertension and diabetes are doing those things less frequently. That's right, than the general population. Now, I told you I was going to give you hope. I'm sorry. I pushed you down in the hole a little bit. Wait a minute. So here's the hope. What percent of people switched and adopted healthy habits? 6 years later, their doctors, the PR, the journals, the magazines, Ladies' Home Journal, All right, it was interesting. It was 8.4%. And we had to keep refiguring that number because it can't be the exact same number as the original, but it almost was. All right, so what did people do?
Did the 8.4 of those 8.4 make the switch?
No. Originally, 8.5% of people were already doing the right things. So 92% of people weren't. And of that 92%, 8.4% decided to start doing the right things. Okay. How did they do it? 78% of them got up to doing all four things by adopting a better diet, by eating fruits and veggies a day. 38% of the people got up there by exercising, because that's what they were lacking. 12% of the people smoked. 4.6% of the people were able to lose weight and change categories. So that's the toughest one, obviously. All right. And fewer... Okay, they say, well, why didn't we look at people that had done everything perfectly? Because there were fewer than 300 of them in the 16,000 sample. That's why. All right. Now, this, my friends, is your hope and why I'm going to send you out happier than I just made you a moment ago. This is people on the left is people that were doing all four, and on the right was the people that didn't adopt those healthy habits. This is how many people had a heart attack, percent. And this is actually fairly amazing. So if you're 50 or 55 or 60 or 65 years old and you switch and you say, I'm going to start doing what Dr. Allman said, I'm going to start doing what Dr. Holt said, I'm going to start doing what my doctor said, in the next 4 years, you have a 35% less chance of dying of a heart attack than if you hadn't followed that advice. That is incredibly, first of all, that's incredibly quick, and second of all, it's incredibly huge. The first statin study that came out in the late 1980s that showed that mortality and cardiovascular disease decreased, and when they first did that study, do you know how much it went down? 14%. If you adopted healthy habits right now and you're a baby boomer, you could do double what a statin does. That is a tremendously positive effect, and there's a tremendously quick payoff. Now, if that's not enough, you get the same payoff of halting the Grim Reaper at the door. If you adopt healthy habits in middle age, right now, if you go out this door and say, I'm throwing the cigarettes down, I'm going to start walking 3 to 5 times a week for 30 minutes, you will reduce your chance of death of 40% in the next 4 years. All else being equal. That is an incredible and a very hopeful message that you can carry to your patients and go home to them and talk to them. All right. 40% reduced likelihood of mortality and 35% reduction in likelihood of cardiovascular events. Adopting some of the healthy habits wasn't as good. That's if you do all four. If you don't do them all, then it's not that good. In other words, if you keep smoking, but you exercise, that'll help a little, but obviously not as much as doing all of them. All right. Now, does adopting the healthy habits help in obesity? Now, the question is, changing categories was the hardest thing. So in other words, if your patients are overweight or obese, the chance of them getting from a BMI of 37 down to 24 is small. I mean, let's face it, with all the technology and all the counseling and all the diets and all the exercise in the world. So the question is, does it still do you some good to adopt? Does it do you some good to eat right and exercise, even if your weight is not changing or you're not changing categories? If your BMI goes from 36 to 35, if it stays rock solid at 33, does it do any good to still eat right and exercise and not smoke? And the answer is yes. It does just as much good. So you should still do that. And you should still counsel your patients that it still does them good. Among obese or overweight or regular weight patients, adopting the healthy habits reduces your cardiovascular and mortality risk. Now, this is something that's also very important for your normal weight patients. So your normal weight patients come in and say, I only weigh 135. I don't have to worry about what I eat or exercise. That is completely false. One of the barriers to people that are normal weight adopting the healthy habits is that attitude. In other words, they still need to eat healthy, eat 5 fruits and vegetables a day, and eat healthy and reduce fat. And they still need to exercise. All those things will still reduce their cardiovascular morbidity and mortality. And this is graphic representation of that. People with 0 healthy habits on the left, and then 1 healthy habit, and then 2 healthy habits, and then 3 healthy habits, and then 4 healthy habits. And each of the different color bars are whether or not they're normal weight, overweight, or obese. But you notice the trend line is solidly better the more habits you have. It doesn't matter if you're normal weight, overweight, or obese. It still does you good to adopt more healthy habits. Are you with me?
On the ones who did all 4, does that include no longer being obese so that it started at BMI over 30?
That's right.
Okay, so then...
That's a pretty tough category, but still, adopting all the other ones, right. And if they could still somehow do that, that would help even more. But even when they didn't, you can see a solid line of the more habits you adopt, no matter what your weight category, it still helps you. That's the take home there, right. That's why in the 4 category, you notice it's 1.0, exactly. All right, so now the next question is, before you go, what are you supposed to tell them to do? Exercise. Moderate exercise, 30 minutes most days of the week, I think is a very simple message. Don't tell them to walk, don't tell them to bike, don't tell them to run, just whatever they want to do. Because they're going to do whatever they want to do. And sometimes in different periods of life, you'll do different things. You start out a runner, and then you become a biker, and you become a swimmer, or whatever. 30 minutes most days of the week. The diet. I recommend the DASH diet, the dietary approach to stop hypertension. Now, although it's called the DASH diet, it is really the American Mediterranean diet. It's free on the internet. This is something you've all been complaining all your lives about what the government's been doing to you. Well, the government made this free to you because NIH funded the research. And I don't know if very many of you know who actually developed the DASH diet. Do you know? It's really funny when you think about it. Dr. Apple. Apple a day. No, his name is Dr. Apple. It's spelled differently. It's A-P-P-E-L. I know that because I accidentally was at the American Heart Association, and I went on the 5K fun run one morning, and I'm out there in my little sweatpants, at 6 in the morning or whatever it was, and this other gentleman, approximately my age, was there, and so we started running together, and I'm talking, and he's talking along. Well, lo and behold, we were just chatting. I was asking him where he was from and everything. Well, anyway, he was Dr. Apple of and he was the keynote speaker. And here I am asking him who the heck he is. Anyway, it was pretty embarrassing, but it did help me remember the DASH diet. It really emphasizes 5 to 9 fruits and vegetables a day, low sodium, and it's very important. It tells you things that you need to eat, as well as some things that you should probably not eat as much of. We don't eat enough nuts, we don't eat enough legumes, we don't eat enough fiber. So it tells you things that you should eat. So it's not just a big no, no, no list. And it has the most, in the color brochure, it is the most attractive looking food that you have. I mean, this does not look like a diet. And second of all, it's not a weight loss diet. It's just a diet to be on that's healthy. And there's different calorie amounts. And finally, just to do one more advertisement for the DASH diet, is that they give you what you should have for that meal. So this is really good for your patients. So it's just like, it's like 5 fruits and 2 vegetables and 1 fat and 1 fiber and 1. It's like, what am I supposed to actually eat? It says, okay, here you go. Cheerios, fruit, yogurt. That's breakfast. Lunch, have a sandwich, have an apple. In other words, it just tells you what to eat. It gives you a 1-week example menu. And there's everything on there from spaghetti to meatloaf to chicken. So it proves that it really isn't what you call an Americanized version. Now, the Mediterranean diet is terrific. There's research coming out all the time that it's beneficial. And the Ornish diet, a stricter, what most of us would call a stricter diet, is also terrific. And I mean, that can suck the atherosclerosis right out of your arteries. I mean, it's unbelievable, their research that they've presented. Okay, quit smoking. Need I say more? Quit smoking. And you counsel your patients. You give them the ask, advise, assist, and so forth moniker. You aim for a normal BMI, but if you can't, you just lose weight. And if you can't do that, you still do the other healthy habits. And then alcohol. Okay, we finally had in the last week the first randomized controlled trial prospective study of red wine in history, and it was a 2-year study. You guessed correctly, it was not done in the United States because they haven't let us do that yet. So it was done outside the United States, and nevertheless, it showed that, and this was people that didn't drink at all, adding a glass of red wine to their patients with diabetes, improved their cardiovascular profile, did not do anything to their liver functions, and increased their HDL. So that was just presented in the past week. Interesting. Now, that does not mean it was adopted by the American Heart Association yet, trust me. They say, if you already drink, it's okay to continue doing so, but they don't recommend that you start drinking for health because of the contraindications and liver disease and other problems that might ensue. All right, and then there's new technology, smartphone apps, and you've heard about those already, and new technologies that you can use to help people do diets. All right. So the lessons from this are that poor healthy habits and rising obesity have led to increasing chronic disease and premature disability and us taking too many medicines. But adopting healthy habits is possible in mid to late life, which we showed from the Turning Back the Clock study, and it has tremendous benefit. And it is not too late for your patients and for you to get healthy. Thank you very much.
Thank you. Thank you. I think I need telepsychiatry. Oh, dear. Do we have any questions? And at least you let us end sort of on a positive note there, and with something to do. And but that's interesting. I for one am glad to know that you can do something and make it move the other way. Go ahead.
The question was, when we started telling people not to eat fat, we all started getting fat. And is there a correlation between the two? I think there's a lot of correlations, and that may be one of them. Eating some fat makes you feel like you're full. And so if you never feel like you're full and you make up for it with carbs, then you can lead to obesity and diabetes. Now, I don't think that's the total explanation for everything that's happened. I think there's increased screen time. We know that in the kids in the younger generation. So, I mean, going from 17% of people exercising, not exercising, to 52% of them not exercising at all is also been a tremendous factor. You know, labor-saving devices and so forth, I think, has also contributed.
It's also the time the baby boomers sort of got into their 20s and 30s and, you know, probably past the teenage years. Go ahead.
So, a comment on that, then a question. American Academy of Family Practice put out an article on nutritional myths and good dietary advice back in May, saying the same thing about how fat keeps you full longer. I think when we tried to make low-fat foods, what we did was make higher level of processed foods, and that really did the opposite of what we were trying to do. You know, because you've got to have flavor. You can have flavor by fat, or you can have flavor by salt and sugar. And when
Yeah, the data I showed showed that we actually increased salt and increased calories. So, and there's been no question that there's been an increase in processed food, so that's not good. And you had another question, I think.
If the data were available, I would love to have seen that same group that was polled in '88 polled again. And for those of them who are still with us, what's our percent who now is diabetic, who now is hypertensive, who now is in poor health? So on the earlier study you showed, is it...
We don't have the long-term follow-up. Those are cross-sectional studies, so we're just comparing a look in time to our parents, so to speak.
But now with EMR, you could take the age group that existed.
We could take the age group that existed then, right, but we didn't have EMRs quite back that far. But
Right, but I mean, do it for now. So the people who are...
But you could, yeah.
In that age group then, do they have the same problems as the other generation now?
Yeah. I think they had them later. I think it put it off a long time. Yeah.
Of the myriad of things that we know about that go on in that environment of food behaviors, whatever they might be, exercise, diet, so forth, all those things that we know about is utterly complex. Is there anything that, out of that bunch of things that stands out that you like to think can account for this food? Or is it way too complex for this conversation?
It's really complex. You know, I've been doing nutrition research for, well, now that I think about it, a couple decades now. And actually, almost every time we found a deficiency, and then we tried to just give you that one thing, it didn't work. You know, we say, oh, well, you're low in magnesium, so we give you magnesium. So I was involved in magnesium studies, and giving you magnesium didn't do anything. Then we say, well, you're low in vitamin D. So then there's a bunch of supplement studies. I just came from a conference, and there was a supplement study of giving people vitamin D. It didn't do anything. So when we find out that you're deficient in something, oh, and what about not the fish oils? So in other words, we don't get enough fish. And so they said, well, we'll just have you take some fish oil capsules. So they did a bunch of randomized controlled supplement studies of giving you fish oil capsules. And what happened? And the answer was nothing. The fact is, you just have to eat. You got to eat your magnesium and you got to eat your fish. And we were going to do a fish study to see like how many servings of fish per day, you know, and so we wanted to look in this data. And it turns out that we eat less than a serving a day. Now, there's some people on the coast, and a few people obviously eat more than that, but we only eat like 0.9 servings a week. So we couldn't compare the high users to the low users because there weren't enough high in there. We don't actually eat enough fish, for example. So I think the way to get the nutrients that are missing is to find foods that have that and eat, and eat the proper diet. If you follow the DASH diet or the Mediterranean diet, you're getting plenty of all the right things.
I try to get my patients to look at food labels and appreciate serving sizes and all that. Do you think there's any opportunity to this heart health label to alter their habits?
I hope there is some opportunity for labels, and I think labels are hard to read. I think they're really difficult to read. In other words, even with some education, it's difficult to know. I mean, should I get more sodium or less sodium, more carbs or less carbs? Is the fiber more important or is the fat more important? And so, and it's an oversimplification, I know, but I'm wondering if it's like, yeah, the green light, the yellow light, and the red, it works in our cafeteria. Actually it works on me. I mean, I go there and I say, oh, God, I better not have a yellow thing today. I didn't work out, And then I say, I've been weightlifting. Shoot, I'm going to get the red thing, man. I don't care. But, but it does. But then I found myself picking the green thing most of the time. My wife said, what did you have for lunch today? I said, fish and 2 vegetables. And she laughed. She said, you have that every day? I said, no, I don't, but I tell you that. But I do eat that a lot more now in our cafeteria, and I haven't had a hot dog in I don't know. I just haven't had one in a long time. So I think the green light, yellow light, red light would help.
I just wonder how much correlation there is in the last 30 years or so with marketing and restaurants, fast food restaurants, giving larger and larger portions. It seems like everyone wants to get their money's worth. When you go to Europe and eat, the portions are much smaller, and I think the obesity is not quite as bad as it is over here. But you go to restaurants, you got this big gigantic portion of food, and you don't want to leave it there. You don't know when to stop eating, so you just eat more and more. Then your stomach expands when you get hungrier.
Yeah, I think there's no question that supersized portions have have gone amazing. Yeah. Yes, Dr.
There's a lot of correlation between obesity, mental health, diabetes, and one of the things I've been interested in for some of these folks that I work with who are smokers, they're folks that hardly have money to pay a copay for the medicine, let alone get a Y on a discount even. About roles of something like benmetrazine or in the use in conjunction with some of these things to reduce weight. Bontrol specifically, or things like methylphenidate, the Adderall, the derivatives, are used as augmentation strategies in depression, but they're also appetite suppressants. And there's been some studies coming out in older folks with low-dose Ritalin in conjunction with the low-dose SSRI do better than just SSRI alone. So began to think of using that to target people with depression who are obese or have diabetes. What are your thoughts about some of those medication interventions to try to promote or jumpstart some of this?
He was asking about medications and medications for obesity, and there's people that need that and people that may benefit, and we need to be conscious of that. But polypharmacy, and I see patients. I'm a primary care family doctor, and I mean I see people that are on 6, 8, 10, 12, 15 medicines, and I resist every bone in my body resists giving them another one for the small incremental benefit that it have, because there are no studies of what happens to you when you add the 15th drug and what are the adverse effects. I mean, there's not going to be that study. And so I say, here's a pair of tennis shoes and, go to it.
I wanted to ask just an observation. In the Mediterranean diet, it seems like it's really good. It cuts down heart disease, and maybe cancer was decreased by 68% in women who were on a Mediterranean diet. I'm thinking, what's so different about it? The one thing that is different about it, it doesn't have any processed food. It's
That's right.
fruits, vegetables, fish, olive oil, nuts, grains.
Fresh food.
Processed foods is causing a lot of the problems that we have, just like trans fats. And
Yeah.
for some reason, they're able to label it as zero trans fats when it can have up to 0.5% trans fats. Our Department of Agriculture allows that, which is ridiculous. If you eat a whole bag of potato chips, you're going to get a lot of trans fats. They're known to cause coronary artery disease.
Yeah, absolutely. I mean, I think processed foods, I think it's becoming more and more evident that that's part of the culprit, and fresh food is the way to go. I'm going to say that whoever wants to take me to dinner can ask more questions, and thank you.
Thanks so much.